The surgery worked. That is what they told you. The surgeon said that everything went well. The scan is clean. The hardware is exactly where it is supposed to be. The incision healed up nicely. And you are still in pain. So you went back. And they told you that everything was normal. They told you to give it some more time. And they told you, at your age, this is what we can expect. You did the physical therapy. You did the chiropractic as well. You did the injections and the dry needling and the massage. Some of it helped for a week, but none of it really stuck. And somewhere in there, something shifted. You stopped asking them what was wrong, and you started wondering what was wrong with you. Because if the surgery was a success, and the scans are clean, and everybody says that you are fine, then the only thing left in the room that could be broken is you. You are not exaggerating. You are not imagining it. And you are definitely not the problem. And nobody has ever told you why. My name is Joe Reed. I am the person you see when the surgery is done and the pain isn't. Here is what actually happened to you. Think about what your body had to do the same day somebody cut into it. It had a wound, and it had to protect that wound. So it shut down everything around the site. It turned down the muscles that would pull on it. It changed how you breathed so the wound would not move. It changed how you walked and stood and got out of a chair. That was not a malfunction. That was the smartest thing that your body has ever done. On day one, it was exactly right. Here is what nobody told you. Nobody ever turned it off. The wound healed. The protection stayed. Your body is still running a survival strategy for a threat that ended years ago. And here's the part that changes everything. When your body takes something offline, the job does not disappear. Something else takes on the job. And in nearly a decade of doing this, I have only ever seen it go to 5 places. Your jaw, your vision, your inner ear, your breath, and your scars. Those 5 are how your body knows where it is and stays upright. It will not do without them. So when the deep system quits, it does not go looking for a spare muscle. It goes to the 5 things that it cannot afford to lose. And it is never where you would look. It happened to me. In 2019, I had an appendectomy. It nearly killed me, and it saved my life. And about once a year for the last 6 years, my back locks up so hard that I can't stand up straight. I would not trade the surgery. I would be dead without it. And I still wish my body had not spent 6 years paying for that surgery. Both of those things are true at the same time. And that is the sentence that nobody is allowed to say. And I want to tell you about my mother, because she is what happens when nobody says it. She had me when she was 18 years old. She had an episiotomy. She had 2 children by the time that she was 20. Pelvic floor problems her entire adult life. She became a jaw clencher, experiencing frequent headaches as well. And she has owned a night guard for quite some time now. For over 40 years, these things have been going on. And in her late 50s, she had a L5-S1 spinal fusion. My mother never injured her back. Not once. Not ever. Her core went offline when she was 18 and I was born. And her back did that job for 40 years. And then it couldn't do it anymore. Every provider that she saw in those 40 years treated her as a list of separate problems. A pelvic floor problem, a jaw problem, a back problem. Nobody ever asked why her back was doing a job that it was never designed to do. So here's the one thing that I want you to do before you close today. Do not think about where it hurts. I want you to think about what showed up after the surgery that has nothing to do with the surgery. The jaw that you can't stop clenching, the night guard that the dentist gave you and blamed on stress, the dizziness, the eyes that got worse, the breath that you cannot get all the way in, or maybe the pain that moved somewhere that they never really touched. You did not mention any of it because it sounded insane, and that is not a separate problem. That is where the job went. So here is where you go from here. You have 3 doors, and I want you to pick honestly. Some of you are across the country. Some of you are across the world. But there is a door here for you too. Door number 1. If you are not ready to pay anybody anything, and I don't blame you, there is a free reset experience in the description. One thing that you can try today: no equipment, no appointment, test, reset, and then test again. Just go see if your body responds. It costs you nothing. Door number 2. If you want to know which of the 5 systems is covering for you, you can test all 5 yourself. Not with the scan, not with somebody's opinion. You feel the answer in your own body in seconds. That is the reset map. It checks the same 5 systems that I check in the room, and you can run it wherever you live. If you are not in California, this is where you start. It is also in the description. Door 3. And if you are done searching and you want my hands on it, the clinic is in Lake Forest, California. The details are in the description. And if I do not find something, I will tell you, and then we're done. I will not book you again just to keep looking. You've been carrying this a long time. You've been carrying it quietly because you were told to be grateful. You can be grateful and still deserve an answer. Both of those are allowed. Your body is not broken. It is misunderstood.